Hello everybody, welcome to the anatomy section for Unit 4, which will be the skeletal muscles. And there are a whole bunch of skeletal muscles in the body. We actually only require you to know about 40 superficial skeletal muscles. So there are a lot of smaller, deeper muscles that you won't have to learn. Stop crying. But before we do that, one of the things that we're going to talk about on the anatomy side as we go through your skeletal muscles is what they do, what are their actions. Skeletal muscles, for the most part, move joints. They pull on bones. That's something key for you to know. Muscles pull on bones to cause joint movements. They don't push on your bones. And so before we move on to those skeletal muscles, and to give us the background that we need to talk about those actions, we're going to go through some joint movement information that is actually in Chapter 8. Some terminology here you need to learn, especially you guys going into physical therapy assistantship, exercise type areas. The terminology here will be especially important for you guys. It's important for everybody, but especially for those going into those areas. All right, so there are different types of movements that can occur at synovial joints. Remember, most of the joints in your skeletal system fall into that synovial category. And some of those movements include gliding movements. We talked about that a little bit already back in Unit 3. Angular movements, this is where you're changing the angle between the bones at a joint. Rotation is just what it sounds. You like here I'm rotating my head back and forth, so you're rotating around an axis. We talked a little bit about that during Unit 3 as well. Then there are some special movement terms that we'll learn, like supination and pronation. You may have heard of those before. Dorsiflexion and plantar flexion of the foot, or plantar flexion. The special terminology that's used there: inversion, eversion, protraction, retraction, elevation, and depression. So a lot of these you see here in that cluster, those 5, those are considered antagonistic movements because they're opposite of each other. Supination is the opposite of pronation. Inversion is the opposite of eversion. And even back over here, flexion versus extension, abduction versus adduction with the D. Those are antagonistic movements as well. It means that they're opposite movements. So we'll be referring to those things as well as we move along. Okay, just briefly, I'm going to talk about gliding types of movements, and this is where you have one flat bone that glides or slips over another. And think about bones that are kind of more or less cube-like in shape, where you have those flat-like surfaces. They're not always perfectly flat. But your intercarpal joints, your intertarsal joints down in the ankles, and then remember your articular processes of your vertebrae, so superior and inferior articular processes. If you actually look at a vertebral column, those processes lie on top of each other, and that's how one of the ways that vertebrae articulate with each other. All right, now actually none of the muscles that we'll be learning about are involved in these gliding type movements. You do have muscles, of course. Movements of any of your joints are going to have muscles involved with making those movements happen, but you don't have to learn all of the skeletal muscles, so some of these are not really going to come up again. But like they're showing you here in this picture, when you do this with your hand back and forth, you're experiencing a gliding type movement between those carpal bones in the wrist. All right, now let's get into some of the terminology that we will be hearing a lot more as we go through the Unit 4 anatomy. These are important terms. So movements that occur along the sagittal plane. So that means if you're looking at, you got a human subject standing in anatomical position and you're viewing them in a sagittal plane, you're looking at them in a lateral type view. So if you think about moving the joint, if the angle at the joint, the angle between the bones at the joint decreases, that's called flexion. You're flexing the joint. Extension is the opposite. If you increase the angle of the joint, that's extension. So these are opposite movements, And you'll see that you'll have muscles that are called antagonistic muscles. And one muscle or group of muscles will do the flexion movement, and then you'll have another group of muscles, or maybe a single muscle, that does the extension movement. And your muscles are always pulling. So one group will pull and cause flexion. One group will pull and cause extension. Then hyperextension is where you go beyond anatomical position or beyond the normal range of motion. So that's excessive extension. All right, so from your textbook, let's take a look at a couple of examples of these. Think about moving your head, your neck. So you're moving your head back and forth, like this. And again, we're looking here in a sagittal plane. So when you nod your head forward, like you see the lady here doing, or like I'm doing, that is flexion at the neck. When you bring your head back up like this, that is extension at the neck. And then if you do this with your head, you're bending your head backwards, that's hyperextension, because you're going beyond the normal range of motion and you're going beyond anatomical position. But relate that back to what we were talking about with the angles. If you are reducing the angle between the two bones or at the joint that you're moving, that's flexion. If you are increasing the angle, that's extension. And then let's take a look at your vertebral column. So you do have some flexibility within those joints along the vertebral column. So if you're bending your vertebral column forward like this, that would be flexion along the vertebral column. You're bringing your vertebral bones closer together. You're decreasing the angle. And then when you stand back up, that's extension. And when you lean backwards beyond that normal range of motion, that's hyperextension. All right, then let's take a look at the knee as yet a third example. So again, notice each time we're looking at these, it's a sagittal plane or a sagittal view, a lateral view that we're taking a look at. So at the knee joint, flexion means you're bringing your ankle upward towards your rear end. So when you raise, you're decreasing the angle there at the knee joint between your femur and the tibia and the fibula. You're bringing those closer together. When you bring your knee back down, you're increasing this angle right in here. That's called extension. And then look over here at the shoulder joint. Now the shoulder is a little bit harder to visualize because it's harder to visualize the change in the angle of the bones at the shoulder. But when we think about flexion of the shoulder joint, it really means you're looking in the sagittal plane. When you raise your arm like that, the motion is occurring here at the shoulder joint. When you raise your arm forward like that, that's called flexion of the shoulder joint. And when you lower it, that's extension. And if you take your arm, looking at it from a side view, and you bend it backwards like this, that's called hyperextension at the shoulder joint. So the shoulder is a little bit unusual. What about the hip joint, where you've got that ball and socket between the ball on the femur and the acetabulum on the os coxa on each side? What's going on there? So if you think about it, flexion of the hip flexion will be raising your thigh upward like this towards the torso. That's flexion of the hip. Extension is going to be bringing the thigh back down toward a anatomical position. And then what about hyperextension? If you took the thigh and you bend it backwards like this, that's going to be hyperextension at the hip joint. Okay, so that's flexion and extension and hyperextension. Now what about if you're looking in the frontal plane or a coronal plane, so from a front view? Okay, you can, there are a number of joints where you can move the bones at the joint away from the midline of the body. That's called abduction, and some people keep track of that by you're taking it away from the body. You're abducting it away from the body like you're stealing it from the body. And then unfortunately the opposite movement is only different by one letter, and that is adduction, and that's where you move at the joint toward the midline. And there's another type of movement called circumduction, where you're doing like this, like I'm doing here with my finger. You're basically making a circle, or as the words there on the slides say, I'm making a cone in space. So at some joints, you're capable of doing circumduction, like I was just showing you with my finger. Okay, so here on this diagram, we're taking a look. So we're looking in a coronal or a frontal plane. We've got a front view. And what about at your shoulder? When you do abduction at the shoulder, you're raising your arm out in this direction, away from the body. That's abduction. Adduction, you're bringing the arm back this way, towards the midline of the body. This is going to be adduction of the at the shoulder joint. And you can also do circumduction, like they're showing you there, kind of rotating back and forth. So you have various joints where you are capable of doing circumduction type motions, more of a circular type motion. Oh, I'm sorry, actually circumduction would be like if you're making a circle with at the shoulder joint with that ball and socket joint that you have there at the shoulder, like they sometimes have you do for warm-up exercises of the shoulder joint. That would be circumduction. All right, rotation. You do have some joints where you can do rotation. So if you think about a bone having its own long axis, imaginary axis down the center, if you can rotate the bone back and forth like that, that's rotation. And so where do we have that occurring? The C1 and the C2 vertebrae, like we talked about when we went over the bones, that's your atlas and your axis. That joint where you have that odontoid process, or the dens on the axis, where it articulates with the atlas, and the atlas goes back and forth like this, that is allowing you to rotate your head back and forth. And so if you imagine an imaginary axis going right down between those two vertebrae, that's you're rotating around that axis. You can also rotate your humerus back and forth. You can't rotate it all the way around, hopefully, but you can do some rotation with that around its axis if you imagine a line going right down the center. Same thing with your femur. You can rotate that back and forth as well. Okay, so here they're showing you, like what I was just demonstrating with the head, rotation of the head based on the atlas and the axis moving around each other. And then your leg, if you think about, you can rotate your femur. Your knee is going to move either in the medial direction or outward in the lateral direction. You're turning your knee in, you're turning your knee out. That would be rotation there at the femur. All right, some special terminology that will come up. Your radius can rotate around the ulna. Okay, and there are a couple of special movement terms for that: supination and pronation. You may have heard of these before, and you may have heard of it associated with running. If you're a runner, most people, or if you imagine this is your foot and you're looking at it from a forward view, most people, when they run, do this. Their foot turns inward, and that's actually called pronation at the foot. Some people, though, their feet, especially if you have high arches, their feet tend to turn outward like that, and that's called supination. Now, what about your radius and your ulna? All right, so in anatomical position, you guys know how your forearm is in anatomical position. Your palms are facing forward. But think about when you rotate your forearm around so that your palm is facing backwards. Or if you're holding your arm out like this, anatomical position, you rotate it like that. Okay, so when that happens, the radius is rotating around the ulna because of that circular head that it has. And so when you're in anatomical position, the hand is backward like this, it's said to be supinated. And when your hand is like this, downward, or your palm backwards, if you're in anatomical position, it's said to be pronated. So supination is a special term when we're thinking about the radius or thinking about your forearm, where your forearm, supination means you're rotating your hand backward, your palm upward or forward. Pronation is the opposite. So the back of your hand would be forward, your palm would be backward if you make that type of movement. If you're into exercise science and you talk about chin-ups versus pull-ups where you grab the bar overhanded, those are said to be your forearms are in the pronated position. Or if you do chin-ups where you grab a bar underhanded like that, your forearms are said to be in a supinated position. So you'll hear those terms in that way as well. Okay, and here's a picture from your textbook, which is showing you the rotation over the ulna to move your forearm into a pronated position, or rotating it back the other way to end up in a supinated position. And we'll talk about the skeletal muscles that allow that movement, that motion to take place. All right, some special terminology in the foot. If you think about your foot like this, if you raise your foot like this at the ankle, that's called dorsiflexion. This is actually the dorsum of the foot. The top part of the foot is the dorsum. So if you bring the top of the foot upward, that's called dorsiflexion. Remember, plantar or plantar, referring to the sole of the foot. If you do this with your foot, that's called plantar flexion, a downward motion at the foot. And there you go. There is a picture of that. So if you come up on your tippy toes, you are doing plantar or plantar flexion. If you bend you decrease that angle between the lower leg and the foot, like they're showing you there, that's called dorsiflexion. All right, another special movement at the foot, inversion and eversion of the foot. Let's just move on over here to the picture. Okay, so this person's anatomical position. This is actually a left foot that we're taking a look at. So if you turn your sole inward toward the midline of the body, that's inversion of the foot. And if you turn your foot outward like that, that's called eversion of the foot. All right, movements in a transverse plane. So here's your transverse plane. And if you move something forward or anterior, that's called protraction. If you move something backwards in that transverse plane, that's called retraction. So let's take a look at the jaw here. When you jut your jaw outward like that, that's protraction of the mandible. When you pull it back like this, that's retraction of the mandible. So you're moving it in an anterior, you're moving the bones there in an anterior direction versus a posterior direction. That's protraction and retraction. Elevation and depression. So if you're bringing a body part upward in a superior direction, that's called elevation. Depression, you're bringing it downward. So you use elevation and depression to think about superior versus inferior motions. Okay, so like if I'm raising my arm over my head, I'm elevating it. If I bring it back down, that's depression. And yeah, the shoulder joint is very complex. So we'll talk about flexion and extension at the shoulder joint, abduction versus adduction, and then elevation versus depression. You have all of those types of movements going on with that ball and socket joint at the shoulder. Here's the jaw again. So you can do elevation when you raise your jaw, depression when you bring the mandible down, like when you're chewing, you're doing elevation and depression, and also some protraction and retraction of the jaw as well. All right, one final little movement. We talked about this with the saddle joint that allows you to make movements, opposing movements between your fingers and your thumb like this, and that allows you to grasp things. That gives humans a lot more dexterity with their hands than other types of primates have, and that's called opposition of the thumb. And we're not going to talk about the muscles that get involved in allowing that to happen, but we're just putting that in here as one of the special movements that occur within your skeletal system as skeletal muscles pull on those bones and cause the movements to happen. And there's your picture from your textbook on opposition type movements. All right, so that's kind of an overview. And don't freak out too much over this terminology yet, because as we go through the different skeletal muscles, I'm going to be pointing out the actions to you. I'll also link a few things for you so that you can watch animations of the different movements and become familiar with them pretty quickly. All right, so on the next video clip, we will wind up beginning to talk about the skeletal muscles on the head.